Very good afternoon to you. I don't think I need to few days back, one a very prominent gynecologist of the city, he was unfortunate enough to land up with a consumer court case. He was a very busy practitioner. He gave all the documents to his lawyer, gave a lot of literary references, but himself was not present during the hearing, which is allowed in the court of law. When the outcome came, it was not in his favor, and he was surprised to see that whatever documents he supplied to the lawyer was never presented to the court. So medico-legal cases are very different from any other civil or criminal case, because it is one thing, the person you are relying upon, you are putting your faith on the lawyer. They may be very proficient in the legal part of medico-legal, but they hardly understand anything about medicine. And from me and Adhish, our experience of interacting with the people of law, we have come to the conclusion that it is much easier to learn a little bit of law ourselves than to make them understand medicine. With that, I would ask Dr. Adhish to start the deliberation.
Thank you. I think I don't need to emphasize on what Dr. Nandi said right now, and we'll dive deep into my talk straight away. Let's take this case in. This is a 10-year-old child who presented with headache, seizures, and vomiting in the year 2010 to a particular neurologist who had completed his DM from AIIMS, New Delhi. And based on a normal report of the MRI, he diagnosed the child to have benign childhood epilepsy, and anti-seizure medicines were prescribed. Now this child and the parents kept on following with the neurologist for the next 3 years, and the child continued to have headaches, continued to have nausea, and continued to have loss of weight. The MRI was not repeated, only an EEG was performed again, and dose escalation of anti-seizure medications were done by that specific neurologist. Now, fed up with this course of actions and the headache not stopping with the 10-year-old child, now 13 years old, the second opinion was sought from another neurologist who promptly ordered an MRI, which showed fourth ventricular tumor with CSF dissemination into the hemispheres as well as to the spine, along with hydrocephalus. Now, thereafter, he was referred to Medanta, where a surgery was performed and medulloblastoma was diagnosed. Adjuvant chemotherapy was started, but after the fourth cycle, the child developed sepsis and died. Now, in this situation, you might be feeling anger against the first neurologist, you might be having sympathy for the first neurologist, and this is something that all of us might be in a situation and face such a situation. Now, what are the questions asked by the court? When this goes to court, what questions does the court ask? The court first of all asks, was there an adverse outcome to treatment? What was the cause of this adverse outcome? And are all adverse outcomes following medical treatment by default termed complications? Are all complications therefore caused by negligence of a doctor? And if the complication occurred despite no fault of the doctor, can the court still award compensation? Is the doctor still liable to pay compensation to the victim, or rather the injured patient? When the doctor is at fault, and therefore when is he negligent then? And when does he actually get termed to be negligent and pay compensation? And if so, when is a doctor criminally negligent to deserve imprisonment? So these are the questions that I'll go through in my talk, and I'd like to educate you and make ourselves more knowledgeable about these things. So what exactly is medical malpractice? When a court or tribunal, that is a consumer commission is a tribunal, determines that a medical professional has not provided the expected standard of care to a patient, making him liable for paying compensation to the injured patient. That is what is medical malpractice. Now, there are two types of adjudication. One is no fault, that is simply like ex gratia payment of the government. Say, for example, when the Air India plane crashed, Tata immediately announced that I will pay ex gratia, whether there is a fault of the company or no fault of the company, whether there is a fault of the pilot, when there is a train accident, whether there is a fault of the pilot, the train driver, or whether it's the fault of the authorities or the railway board, it doesn't matter, an ex gratia payment is made. So this is called no fault liability, and certain countries like New Zealand, Sweden, Finland, they actually have such system in place where if a person goes to the hospital, sustains any adverse outcome or complication, loses a limb or dies, then a no-fault compensation is paid out. But in our country, it is not so. There is a certain procedure that is followed in common law, that is all the Commonwealth countries follow this system, whereby compensation is only after adversarial adjudication. What is adversarial adjudication? There is one complainant, one party, there is a defendant, doctor, another party, and a third person, the judge, adjudicates between the opinions of both the parties and then says that yes, the complainant is correct, the defendant has been at fault. Now this fault has a component of moral blameworthiness or culpability, that there is a moral wrong that the doctor has done. That's something that a doctor should not do. This should not do is a very important term in tort laws, and which is not just something that is a simple lapse or a simple inadvertence that has caused the adverse outcome in the patient. And I'll come to it in my next slides, that this specific notion that the doctor has to be morally blameworthy has led to a culture of blame. So wherever there is a case now against a doctor, immediately the conclusion of the media or the society is that there has had to be a fault of the doctor which has resulted in the complication, and by not understanding that there can be inadvertent slips, lapses and errors. So let us understand that every complication, every adverse outcome is not a complication. Complications are any undesirable or unexpected outcome following a surgical procedure or a medical treatment deviating from the expected recovery or outcome. And it does not include a failure to cure the illness. So if you have given chemotherapy to cure a cancer but the cancer has progressed, it's not a complication. It's a failure of the chemotherapy, failure of the illness, it's not a complication. What is sequelae or consequence is any inherent or inevitable after effect of a well-executed surgery or a medical therapy. So if you have a scar after surgery, that is seen in 100% of cases. It's a sequelae. So any treatment that you say, for example, you prescribe a medicine, and if in 100% of cases there is a specific reaction or a specific action that takes place in the patient, then therefore that is a sequelae and not a complication. For example, if you have a patient who has hemothorax and you put an ICD drainage, the patient in following X-ray will definitely have a pneumothorax. But that pneumothorax is not a complication, it's a sequelae of placement of the ICD. So it's very important to understand what is a complication, what is a sequelae, and what is failure to cure the illness. Moreover, every complication is not a negligence. So you can have system errors, that is inevitable errors or that can happen despite every safety measure in place, like a WHO checklist in place. Even then you can have a wrong patient surgery, and there are multiple cases of that, not multiple but a few. There may be human errors like wrong medicine being injected into the patient at the wrong time because of an emergency, and there has been convictions based on that. Error of judgment is always in hindsight. So you have a patient who had a pain in the abdomen, a swollen abdomen, and you went for an emergency laparotomy, but you found nothing inside that was necessary to be operated. But it is always in hindsight. At that point, whatever you had deemed it to be justifiable to go ahead with the laparotomy was justified at that moment in time. In hindsight, you will always be more intelligent. So, again, bona fide mistake in treating an infection for malignancy, malaria as dengue, or like I said in the first case, treating medulloblastoma as a benign epilepsy. These are all bona fide mistakes, but again, all in hindsight. Technical error, like poor reduction of a fracture during surgery, is a technical error. So these are all errors, and including an anaphylactic shock. So you give a medicine and you have an allergic reaction. These are all beyond the doctor's hand. So it's an act of God, and these are all complications or lead to complications, but not all of them are complications following professional misconduct. And that is what is the crux of my talk today, that how is medical negligence determined? It is not determined by simply the appearance of a complication. A moral wrong by a registered medical practitioner as determined by a judge that needs a remedy, that is compensating the victim as well as disciplinary action against the doctor, is what determines medical negligence. So there are three questions that the court asks, that there was a duty of care. So for example, in the patient who had medulloblastoma, whether the patient came to the doctor, whether the doctor examined the patient, whether the doctor appropriately ordered all the investigations, there is a standard of care. So now, very important to understand that this is not ideal treatment. In various talks or conferences that I go to, there are sometimes questions asked by the panelist or by the presenter that what is the standard of care for, say, example, migraine. So there is nothing called standard of care. Standard of care is a completely legal term. It's not a medical term at all. And standard of care is only applicable for that particular case, for that particular specific to the facts of the complaint, and it is only determined by the determine that what is the conduct of the professional in that given situation for that given patient on that given date, and that is what determines standard of care. And of course, that deficiency in the conduct of the professional will determine his negligence, and therefore, what was the court's adjudication in that case? So the court deliberated on the question of delay in diagnosis of medulloblastoma, and hence the treatment was also delayed. So the first neurologist had documented that there was an unexplained loss of weight, and that unexplained loss of weight was not followed up by an MRI. So if you have a headache or a benign epilepsy, it's a red flag that the patient continues to have significant loss of weight. And in that situation, a prudent or a reasonable physician or another neurologist will always order an MRI to make sure that there is nothing else that's going on. So that is where the standard of care was lacking in this particular case. This does not mean that in every patient or every child who has epilepsy and headache, you go on of ordering MRI every month. In this particular patient, given the specific facts of the case, you should have ordered, and that is what the court or the judge determined, that that is something that is the fault of the doctor. The doctor should have ordered. It is morally wrong for him to have not ordered, and therefore he was negligent. And of course, compensation of 50 lakhs and other things were paid out. So, Bolam said, now this is an article that I wrote with another one of my colleagues, that what is therefore a reasonable doctor? When do you think the doctor has not acted reasonably and therefore is negligent? So, when the doctor is aware that an alternative pathway is both reasonably available and more likely to achieve a given objective safely, and which no reasonable medical professional in his position would avoid, yet he consciously or deliberately chooses the less satisfactory option, that is, makes a conscious and deliberate deviation from the norms or guidelines, he is guilty of professional misconduct. For example, if I come to the last talk, in the end there was a lot of discussion regarding whether a particular migraine medication should be given prophylactically, should be given after acute therapy fails, or whether chronic therapy fails. So in this situation, if there is a patient who has had a certain migraine attacks, and if you are not prescribing a prophylactic medicine which is already approved and proven to be effective, then are you doing the right thing by not prescribing that medicine to the patient? Now, there are various levels. Now, if you say I am negligent, am I negligent to pay money to the patient because I have not prescribed that medicine? The patient has to show. It's the liability, it's the responsibility of the patient to show, yes, this doctor has not prescribed that particular medicine for prophylaxis. Therefore, I have suffered this much. I have lost this my income. I have lost my job. I have had social issues. I have had marital problems, and therefore I have lost this economically. And I am injured because I have not got that medication. And therefore, the doctor has actually morally at fault because he knew that there was an alternative available, there was a better medicine available, but I was not given that medicine. But that has to be proved by the complainant by producing expert opinion, by producing medical literature, and of course the doctor can also show his medical literature to show that no, it was not indicated. So case 2, a patient, Dr. Sridhar, a dental surgeon who met with a car accident, and a CT scan was performed, showed a contusion in the left posterior temporal lobe, and the patient continued to have headache and vomiting. So another CT scan was repeated, and that CT scan showed a hypertense collection in the right quadrigeminal cistern and interhemispheric fissure. However, because the symptoms abated by a certain degree, he was discharged after 3 days. The patient had mild symptoms but slowly improved. And of course, because he was a doctor, he got involved in his practice and didn't come up for follow-up for the next 1.5 months. What happened is 1.5 months later, suddenly the patient fell down and had severe headache and vomiting and slipped into a coma the next day. When he was admitted to the hospital, now another hospital, the CT angiogram showed frontal SAH and a large hematoma. The patient died the following day. So when it came to court, the court said that where is the Bolam standard of a reasonable doctor that has been violated? So the violation was at the point when a CT angiogram was not ordered. When you have on CT scan, the second repeat CT scan, that there is a collection, there is already a hematoma in the brain, in a space, in a place which is not explaining his original trauma. So you should have gone ahead and done a DSA or a CT angiogram to show that there is a blush or there is an aneurysm which is bleeding somewhere else. It's a double pathology that this patient had. So because you have not done a CT angio and tried to diagnose that what he had, in spite of presence of certain red flags, so therefore you are negligent, and therefore 25 lakhs is awarded. Again, that doesn't mean that for every patient who has a hematoma, you keep on going CT angiograms in every patient every 2 days. That is not what is standard of care. Standard of care is what, for that particular case, required to be done by a reasonable professional, and which no reasonable professional in his shoes would have avoided to do. So, can a doctor be imprisoned for such a negligence? So, it came up, Dr. Suresh Gupta, late Dr. Suresh Gupta, he was a cosmetic surgeon, and he operated for rhinoplasty for a deviated nasal septum, and the patient died. He went into PVS and then later on died. So the expert opinion was that death was due to asphyxia following aspiration of, and this was 1994, mind you, when we didn't have access to cuffed endotracheal tubes. So he used, the anesthetist used a non-cuffed and ET tube of not a proper size, and therefore obviously he had aspiration when he was operating. So it went to court, it went to Supreme Court. And Supreme Court on 2 subsequent judgments ensured that no, see, the act complained against the doctor must show that the negligence or rashness is of such a high degree as to indicate a mental state which can be described as totally apathetic towards the patient. Now, what is this mental state, that recklessness that is being talked about? So, for example, you've been to a party and you have a couple of drinks, and thereafter you enter your car and you drive and you go home and there is no accident. Are you morally at fault to have driven the car? Of course you are. You're breaking the rule, you're morally at fault. But there is no injury. Now, if you hit a person on the road, you might say, I was in full control. You might check your blood alcohol level and it might be actually be less than that. But that is your defense. But where did you consciously decide to actually be morally wrong? It is at the point when you open the door of your car. When you know that you're drunk, there is an alternative available, you can take a cab or you can ask your driver or another person to leave you home. You chose deliberately to throw caution to the wind, be reckless, and open the door of the car. That is where is the misconduct, not when you're hitting the person on the road. So it is very important to understand where the misconduct happens. So you're morally at fault, and that is what negligence is, and that is where that is from where the jurisprudence comes to medical negligence. That where, at what point you have not acted or you have omitted to act in the best interest of the patient, and therefore the patient has gone on to suffer injury. Of course, in another verdict, the court said that therefore the criminal cases, the threshold for proving negligence is much higher. Criminal negligence must be proven, and a surgeon cannot and does not guarantee that the result of surgery would invariably be beneficial, much less to the extent of 100% for the person operated upon. So the Supreme Court has always come to the doctor's aid that if there is a problem after surgery, a complication after surgery, it does not automatically mean that the surgeon is at fault. There is no way a surgeon or a medical practitioner can 100% guarantee that there will always be improvement after surgery or after any therapy. So in civil cases now, however, that the burden of proving this negligence, that whether you had indeed conducted yourself wrongfully and that indeed actually injured the patient, that burden of proof on the complainant is quite low. It's not as high as a criminal negligence matter. So for example, if you have had a post-operative bleeding or a hematoma, say for example you operate on the belly and you have hemoperitoneum, so civil liability might be that you forgot to check a pre-operative coag profile in this patient. Suppose there was adequate time, it was not an emergency, and you had the time, you checked hemoglobin, you checked the other parameters, but you did not check coagulation profile. And then the patient landed up with a hematoma, he had to undergo another laparotomy, then ended up having some other problems or some colostomy or something else. So that is something that your misconduct in not checking a pre-coagulation profile led to all those issues. So that's a civil liability. But for example, if this patient indeed you have operated and has a hematoma, now the ward sister calls you and says that this patient is having swelling in the belly and the patient is having pain and the blood pressure is falling. And you say, no, nothing to be done. These are all normal things. You just give some saline and that's it. And you keep the phone down, you go off to sleep. The patient, nobody has noticed that in the urobag there is 1 liter of blood. So now this patient goes into severe hemorrhagic shock. Then you start CPR and say that, okay, Hospital tried to save the patient but could not be saved. So this is something that is complete recklessness. So you have thrown caution to the wind. You are morally at fault. You have not come to the patient rescue when the patient is bleeding out. So this is criminally negligent. So now, once we have done this, it comes to your mind, okay, can I take consent for this? Can I take consent for hemoperitoneum? Can I take consent for hematoma? Can I take consent for some complication after I prescribe some medicine for migraine? Can I do that? No. Answer is absolutely no. You cannot take consent for misconduct. What you need to take consent for, however, is to inform the patient and to empower the patient to take a decision whether or not to go ahead with this elective therapy. In emergency, there is no question of consent, but in an elective situation, you need to inform the patient. And this very act of disclosing the risks, benefits, and alternatives and adverse consequences of surgery has been made to be a legal duty. So if you don't disclose, you're automatically held to be negligent. If your consent form does not have all the adequate disclosures. But now you will say, shall I inform everything, like the risk of 1 in 1 crore of having a very, very rare complication wherein the patient might die. So here the Supreme Court says that no, you have the power of therapeutic privilege. Very, very rare complications and high risks which are extremely rare need not be explained to the patient, and you will have to understand which patient to tell all the complications to, which patients to hide certain very, very rare complications to, depending on the patient. And that is where a reasonable and a prudent physician, definition of a reasonable and prudent physician comes in. That is a duty. For example, you can't take consent for wrong limb amputation. You can't take consent for mismatched blood transfusion. These consents cannot be taken. So the point is that some people say that, okay, I will take a 100-page consent and it will describe all the complications. So you take a call whether you, after seeing the complications, whether you go for the surgery or not, or treatment or not. The answer is no. It will not save you from a lawsuit. What can save you indeed is the indemnity insurance, and indemnity insurance is mandatory even for trainees, and it will pay for the advocate to provide legal advice, frame response to legal notices, represent the defendant in civil court and indeed in criminal court till there is a conviction. And once initiated by the indemnity provider, the cover continues even if the defendant shifts to another insurer or indeed dies. So take home messages: ensure professional indemnity cover at least 2 crores or even more if you want, good consenting practice, communicate the consent, maintenance of accurate medical records and imaging is essential, ensure that documentation of your decision making in the case file as well as in the discharge summary. So what exactly made you decide on this particular mode of treatment must be crystallized in your documents. It should not be this was done and that was done and this is what has happened. It has to be what your logic was, why you did not do a CT angio despite having headache or whatever red flags were there. Why you did so, that decision making has to be documented. Make all attempts to identify the cause of the complication that led to death or injury, because a reasonable explanation and an apology with a pledge not to repeat the same act or omission plays a vital role in helping families find closure, and that's what prevents a lawsuit in the future. And always take the help of a medical-legal expert before framing your legal defense. Thank you, and I give my regards to both the late Justice Lahoti and Justice McNair, because they are the people who enable that doctors can practice with their head held high. And it's only because of Justice Lahoti that we doctors cannot be arrested simply based on an allegation of negligence by a patient party. And Justice McNair is who made the Bolam standard, which has been in practice for the last 75 years. Thank you.
All medico-legal issues brings out a lot of questions, queries. So we are conducting a medico-legal workshop sometime just before the pujas, end of September. We will communicate the dates to you. It's going to be probably the first of its kind in Kolkata. It will be a workshop where we will talk about individual case scenario depending on, it's a multidisciplinary thing, surgical, medical and all. We will include the date. Those of you who would be interested can join us. Thank you.
Thank you, sir.
Any questions? And I'll be happy to, or Dr. Mundi will be happy to answer if you have any.
Actually, there are a lot of questions, but like, I think we are unsure.
The main problem is that all of us feel, the problem is that all doctors, whenever they face a complaint in a consumer court or any other court, they feel that they should hide it from society. There's a social stigma attached to it. That is something that we want to take out. That there is no social stigma attached to when you get a consumer courts complaint alleging that you are negligent. It is something that all of us have to face. And if you face it with your heads held high, then there is nothing wrong with it. There is no social stigma attached to it. So, yeah, please.
So, lot of the hospitals are residents with them, the consultants are residents along with them. And sometimes during the rounds, the residents give the notes and case seen by the name of the consultant, with the resident signing the note and signing in below it. So how is it admissible in the court of law?
See, there have been more than one judgment on this in Supreme Court as well as in the Consumer Commissions. If a doctor, a senior doctor, understands and that this particular junior is capable, responsible and prudent, and you take full responsibility for that junior, that he or she is writing on your behalf, then it is perfectly fine, and whatever he or she writes, you are liable directly for that. It is basically another agent, you are acting through the agent.
Yes, that comes, vicarious responsibility is okay, but
yeah,
whether the court accepts that that note to be written on behalf of the consultant.
See, whenever you are faced with a moral dilemma, that whether it is wrong or right, just put yourself, ask yourself this question: whether another reasonable physician would do the same thing or not. The bottom line is the court determines whether you are negligent or not, but the standard of care is determined by us, the doctors. Is it a standard of care across the board in the hospital or in other hospitals in this city or other hospitals in this country? Is the same practice, same tradition continued, that there is a junior person who is getting taught by you, he writes the note? If it is yes, then of course it is correct. If it is that no other physician does, no other physician lets a post-op day one note being written by the junior, then where you have not seen the patient, then it is not standard. The standard of care is determined by us. Court does not determine whether a conduct is incorrect or correct. I hope I am being able to make you understand.
Sir, one question. Suppose there is a medico-legal case, the court will not understand all the tidbits regarding the medical issues. So the case will initially probably go to a medico-legal body or something, like in West Bengal they go to the some sort of.
They take help of medical experts.
Medical experts.
Some actually government hospital doctors or some other.
Depends on
called as experts.
Depends on civil or criminal. So each has its own. Suppose a patient has had an adverse outcome, patient can directly go to the consumer court and file a complaint without any expert evidence.
So the court will send the case to the medical experts, or court will
No,
itself
see,
go to
depends on the jurisdiction, depends on the court. In a consumer court, matters are different. So these are very, very complicated questions. A simple answer to this question cannot be given, because there is a criminal court, there is a civil court, there is a consumer court, there are medical councils, there is the investigation commission. Everybody has their procedure, and the procedure is different, and all these are very much complicated by various high court and supreme court judgments. So the fact of the matter remains that if you receive a notice from anyone which alleges a complication, alleges a fault or negligence on your part, you get an expert opinion. Whether that court gives or that person gives or not is immaterial. You provide the expert evidence, and it is within your right to provide expert evidence by any other prudent physician who is your peer or your senior, and you can put it in your defense.
So the doctor can vouch for a clinical opinion.
Of course. And the patient can also bring 20 other expert opinions. Indeed, in Supreme Court, there has been a case very recently where the Supreme Court has judged that the patient who expired, both his siblings were doctors, but they were MBBS doctors. And this was a particular case, I'm not pretty sure, but kidney transplant, as far as I remember. So the doctor said that the kidney transplant surgeon, has taken expert opinion of another kidney transplant surgeon. Whereas the defendant or the complainant has rather taken the opinion of an MBBS doctor. So I cannot adjust. So there is another level of adjudication of medical experts, that is the Bolitho judgment, which is not very much implemented in India at present, but Supreme Court has also taken cognizance of that in one or two judgments, wherein the reasonability of the expert's opinion, whether one expert is logically saying or giving the correct picture to the judge versus another expert's opinion which is illogical. So the judge is the expert of experts. Judge is not the expert himself. The judge will only choose the expert's opinion based on which expert's opinion is logical. So So you have, that's why I said that always have an explanation and a logical explanation for all the adverse events that have happened in that particular case. Have a logical explanation. If you have a logical explanation and if you can impress upon the court that I have acted in a reasonable fashion and anyone in my position would have acted exactly the same way or would have omitted to act in the same way exactly as I have, you are not negligent. The problem is with the tort law because it has to prove negligent or morally fault in the law. That is the problem. In other places you have an error, you have a wrong prescription medicine that is administered by the nurse, automatically there is a no fault liability that kicks in, you are paid by an insurance. You had a problem in New Zealand, you pay off. There are pros and cons of both systems, but it is what it is.
Thank you, sir. Thank you, Adhish sir, for clearing our doubts. Now I would like to invite Dr. Dugal sir to felicitate both the speakers and the board.
So our workshop is probably